Boston Medical Products proudly manufactures many of the finest medical devices available on the market today for use in ENT surgery and airway management. Boston Medical Products was founded in 1980 by 3 otolaryngologists. They wanted to provide the resources and professional skills necessary to make available to physicians throughout the world a complete line of specialty products. Working closely with surgeons, other healthcare providers, and patients themselves, Boston Medical Products has grown and evolved into an internationally respected medical device company. We are dedicated to providing the finest quality, most advanced products, combining safety, effectiveness, and unsurpassed patient comfort for use in otology, rhinology, laryngology, and airway management. Boston Medical Products takes great pride in the manufacturing and quality assurance of each and every product we sell. All of our medical devices are constructed using the highest quality medical grade materials and manufactured under strict quality control procedures. Our knowledgeable and friendly customer service professionals answer technical questions and facilitate orders daily. Most products are shipped the same day they are ordered and delivered according to your specific needs. At Boston Medical Products, we are constantly improving our existing products and developing new devices. Our quest for innovations to improve surgical procedures or enhance patient comfort never ends. We value your input and welcome inquiries regarding new innovations and custom products. Please call us toll-free at 800-433-BMPI. Outside the continental U.S. at 508-898-9300. Or visit our website at www.bosmed.com. The patented Montgomery long-term cannula is the result of many years of clinical research and design. This unique tracheostomy tube has helped thousands of patients for over 20 years. Used to replace either the Montgomery short-term cannula or a standard tracheostomy tube, the long-term cannula features a flange design to keep the tube in place. This means no portion of the tube protrudes into the trachea. The Montgomery long-term cannula is designed for long-term use as a tracheostomy tube. Common terms used to describe this type of tube include tracheal cannula, stoma button, and trach. A tracheostoma is the opening in your throat where your tube is placed. Some patients with a well-established tracheostoma are comfortable removing, cleaning, and replacing their cannula. Other patients leave the cannula in the tracheostoma and clean it in place. This is a personal choice and one that the patient must discuss with their physician. Made from flexible medical-grade silicone, the long-term cannula has a highly polished surface to provide comfort while in place. This surface also helps to create a healthy and smooth tracheostoma. The external portion of the tube features a ring and groove system. This design allows a ring washer to be applied, ensuring patient safety. A Montgomery speaking valve is easily attached to the long-term cannula. The tube can also be trimmed to a low profile. The Montgomery long-term cannula is comfortable, safe for long-term use, and is easy to care for. In this video, you will learn how to replace a standard tracheostomy tube with the long-term cannula, clean the long-term cannula in place, and remove, clean, and replace the long-term cannula. This patient is being converted from a standard tracheostomy tube to a Montgomery long-term cannula. The tracheostomy tape is cut and the tube removed. Prior to insertion of the long-term cannula, the tracheostoma may be sprayed with 4% xylocaine. The Montgomery Stow Measure is a special device used to accurately measure the tracheostoma for proper fitting of the Montgomery long-term cannula. The Stow Measure measures both the diameter and length of the tracheostoma. With these measurements, the patient can be fitted with one of 24 different models of long-term cannula. On one end of the Stow Measure, there are 3 knobs representing the different diameters of the long-term cannula. If the diameter of the patient's existing tracheostoma is not known, these knobs can be used to measure the diameter by gently inserting each one until the correct fit is achieved. Since the patient in this video had a size 6 tracheostomy tube, the diameter of the corresponding long-term cannula is already determined. We now need to measure the length of the tracheostoma. To measure the length of the tracheostoma, the angled flange of the stomeasure is slowly inserted into the stoma and then pulled back gently until it engages the anterior wall of the trachea. The ring washer is slid up to the skin and the stomeasure removed. The number on the shaft of the stomeasure directly under the ring washer is noted. This number is used to select the correct length long-term cannula by referring to the selection chart included with each cannula. This chart is also readily available from Boston Medical Products by fax, email, or over the telephone. To confirm that the proper long-term cannula was selected, a side-by-side comparison can easily be done. A thin coat of ointment is applied to the cannula. The cannula is grasped with curved forceps and inserted into the tracheostoma. The cannula is rotated so that the groove is in the 6 o'clock position. The ring washer and plug set are manufactured so that a small silicone lanyard connects them. This design helps prevent loss of the plug. If desired, the plug and ring washer can be easily separated by snipping off the lanyard with the scissors. Following insertion, a ring washer is applied. It is important to hold the cannula while applying the ring washer to prevent movement of the tube. The cannula can be trimmed to a lower profile by using a scalpel or scissors. It is important to trim the end of the cannula flush with the ring if a speaking valve will be attached. The plug can be replaced or a Montgomery speaking valve attached. The Montgomery speaking valves are available in either silicone or plastic and feature a unique cough release mechanism. The valve is easily attached to the cannula by simply pressing the base of the valve onto the cannula ring and groove. You will need the following equipment to clean your cannula in place. These items should be readily available from your local pharmacy or doctor's office. A mirror, hydrogen peroxide, cotton-tipped applicators or Q-tips, alligator forceps, a suction machine with suction catheter attachment, and bacteriostatic ointment. If you are cleaning your cannula by yourself, position yourself in front of a mirror with good light. Before cleaning the inside of the cannula, remove the plug or speaking valve if attached. 100% hydrogen peroxide, or a solution containing 1 part hydrogen peroxide and 1 part normal saline, is used. Dip a cotton-tipped applicator in the solution and carefully clean the inside of the tube. Forceps may be used to remove crusts and thick mucus. Suction may also be used to clean the inside of the cannula. Clean the skin surrounding the ring washer using the same solution. A bacteriostatic ointment can also be applied to the skin. Patients should remove and replace the Montgomery long-term cannula only after being trained by a physician familiar with the device. It is recommended that the cannula user keep 2 cannulas on hand so that a clean spare tube is always available. You will need the following equipment to clean your cannula after removal. These items should be readily available from your local pharmacy or doctor's office. A mirror, a container with hydrogen peroxide, alcohol swabs, lubrication, and cotton-tipped applicators or Q-tips. The cannula is removed by pulling it forward with a slow, steady pull. The tube is then placed in the hydrogen peroxide solution. A solution of mild detergent and warm water may also be used. The cotton-tipped applicator is removed from its package and used to remove the cannula from the hydrogen peroxide container. The cannula is rinsed under warm running water and cleaned with the cotton-tipped applicator. This patient also uses an alcohol swab to clean the smooth portion of the cannula and rinses again. A thin layer of lubrication is applied, and the tube is reinserted into the tracheostoma. The patient confirms the groove is in the 6 o'clock position. The speaking valve is rinsed and reattached to the cannula. The Montgomery cannula speaking valve features a cough release mechanism. Following a forceful cough or excessive airway pressure, the thin silicone diaphragm pops out. The patient then simply presses the diaphragm back into the housing and the valve operates normally. The signs of troubled breathing include noise from the tube, difficulty speaking, shallow and fast breathing, anxiety, crowing sounds from the throat, change in skin color to pale or blue, or skin feeling cold but damp to the touch. If there are signs of troubled breathing, you should place the palm of your hand over the cannula to assess air movement. Listen for equal breath sounds. Make sure the groove in the cannula is in the 6 o'clock position. If not, rotate the cannula slowly until it is. Look to see if the inside of the cannula is clear. If not, clean the inside of the cannula. If these measures are not effective, you should then remove the cannula and call your physician immediately. If after removing the cannula the situation does not improve, activate your local emergency services, dial 911 or your local police. Be sure to inform emergency personnel that the patient had a cannula in place. Show them the cannula and the instructions included with the product. For more information about this product, please contact Boston Medical Products at 1-800-433-BMPI. Outside the continental U.S. at 508-898-9300. Or visit our website at www.bossmed.com.